debate will need to be in the chamber. Mr O'Kane, around 6 minutes.
Thank you, Deputy Presiding Officer. And in rising to speak in this debate, I feel a number of different emotions. First, an overwhelming sense of sadness about the lives lost, because behind every number is a person, people who were sons and daughters, parents, partners, family and friends, and brothers and sisters. And I think Colette Stevenson very powerfully outlined that, as others have in the chamber today. The word scandal is often overused in our politics, but there is no other word. It is painfully sad and heartbreaking for those who are left behind, people who have all too often struggled to get the right support at the right time for their loved ones. I do feel anger as well, Presiding Officer, anger that quite simply not enough has been done to tackle the root causes of the problem, to be innovative and flexible in approaches to policy around care and treatment, and there has not been enough funding to properly support services and indeed a lack of prioritisation of the issues. Long before the COVID-19 pandemic, a pandemic was raging in our cities, towns and villages, a pandemic born out of poverty, trauma and poor mental health. A pandemic that demands a public health response, one of the size and scale of what we see in our current day-to-day context. It will take leadership and a genuine commitment to listen. And we know that in the past that hasn't always been the case. The Scottish Government were warned that cuts to alcohol and drug partnership budgets in 2015-16 would lead to more death, but they went ahead with those anyway. And we on these benches have long called for funding to reverse these cuts, so it is welcome that the Government appear to be listening. I want to focus my comments this afternoon on the public health response that is required to this crisis. Reporting isn't regular enough. The annual reporting on death, which is 2 years retrospective, is not adequate to be able to react with the flexibility we need. And I know that the Minister has touched on that, and I hope that she will say more in her concluding remarks. Throughout COVID, we have had a wealth of data at our fingertips and on our television screens on a daily basis, as Michael Mara referred to, analysis of trends, data-led decision-making. And we're all acutely aware of the importance of intelligence such as this in making the right public health decisions. It can be done, so why then shouldn't it be done for drugs death? We also need better data on issues like the number of people who are dropping out of treatment. The Scottish Drugs Forum has highlighted the high levels of poor retention of people in treatment, and we know that through research by the University of the West of Scotland that there have been significant challenges in alcohol and drug partnerships, properly recording the number of unplanned discharges, and crucially, the reasons behind those, that would allow then for consistent follow-up and support for people to re-engage with services. Scottish Labour's amendment calls for robust scrutiny of the new MAT standards, including 6-monthly reporting to this Parliament. We must ensure that how we will know if the standards are being met and the impact that important interventions such as same-day access to services are having. Too many people are being failed by inflexible services, leading to those unplanned discharges I have spoken about. Indeed, the Scottish Drugs Forum have said that treatment needs to be attractive and offer what people want when they want it, and it needs to respond to changes in what people want over time. Substitution prescriptions, support to access immediate health or social issues, support with longer-term mental or physical health. We must invest in services such as those advocated by the Royal Pharmaceutical Society and others. For example, the availability of naloxone in a variety of community settings and appropriate training for a variety of individuals in communities and healthcare settings on how to use it. And in common with many other organisations and parties across this chamber, we must have meaningful and swift action on exploring all options to deliver safe consumption rooms. Breaking down silos is also key. We cannot just pay lip service to initiatives like Housing First and then witness sustained cuts to local government budgets for support services and housing. We also know some of the concerning challenges that have been raised by Shelter Scotland relating to people being forced to give up their homes, having been told that they cannot claim housing benefit, which is needed to pay for stays at residential rehabilitation centres run by the voluntary sector. Presiding Officer, I spoke at the beginning of this speech about the range of feelings I had approaching this debate. But I also feel a sense of hope. Hope that we can work in partnership across the chamber. Work with individuals, their families, communities, those who provide services, those who provide support, whether that be in healthcare settings or in local government. But we can only do that, we can only achieve that sense of hope and optimism in this debate, if the government is willing to listen. And I do believe that from the tone of the debate today and the contributions, that there is a sense that the government are listening. We on these benches will hold the government to account. We will relentlessly seek the data we need, we will interrogate it, and we will continue to make the case for well-resourced, flexible services that prioritise individual needs and trauma-informed practice. Because, Presiding Officer, lives depend on that action, and we need to ensure that we all collectively take responsibility, make the right decisions and move Scotland forward to deal with the scourge of drug death. Thank you.
Thank you.